Hi, I'm Dr. Edward Alvarez, and I've been in practice here in New York for about 22 years. I currently own both NYC Laser Dentist and Madison Avenue Face and Body. Due to COVID-19 and the coronavirus, we've all had to reassess our infection control protocols. And I want to make this video to assure you of the changes we've made, and so you can see how you're going to be a lot safer coming here to our practice in the near future. First, we're going to start with the initial screening. Whenever a patient or visitor or anybody comes to our practice, they'll be met by one of our staff members at the door. At which point, they'll be asked certain questions, anything from any flu-like symptoms, any exposure to COVID-19 coronavirus, any positive results, or anything that has made them feel unhealthy in the last 2 weeks. We'll then take a temperature reading with our touchless infrared thermometer, making sure that there's no fever. Our staff will also be measured daily to make sure that we're all afebrile or have no fever, so that you're safe as well. After that, our patients will be brought straight into our treatment rooms to minimize exposure. Throughout our office, we're going to have medical grade HEPA filters by a company called Austin Air Systems that's right here in New York. Once in our treatment rooms, we're going to have a three-pronged approach to help control the environment and to prevent any type of cross-contamination or infections. First, dentally, we're going to continue to use the IsoLight system, which is an intraoral system that has a vacuum and also covers the oral pharynx, thereby minimizing any virus or bacteria that's breathed out by a patient during a procedure, as well as controlling any aerosol that's created during dental treatment. The vacuum will actually suction everything out, or in this case, it's going to suction everything into the mouth and thereby preventing it from going out into the atmosphere. For anything that might escape out of the mouth while doing any treatment, we have something called the Vanaman Vanguard Gold extraoral system. And what it is, it's also a HEPA vacuum system that will have a high volume suction that will be placed next to the patient's face or oral cavity. This is also going to be used whenever we're doing anything such as microblading or any of the other dermatological procedures that we do here. This will then suction out any aerosols, any contaminants that may be breathed out by the patient or anything of the such, and it also will be passed through a medical grade, hospital grade HEPA filter, thereby returning only clean air back into their environment and minimizing any contamination that may be in the room. Third, we're going to be using something called UVC Light. UVC Light, and in this case, we're going to be using a piece of equipment called the Lantern, which is created by a company called Cordisis from New Jersey. The Lantern is typically used in the back of ambulances as well as in hospital treatment rooms to completely bathe the room in UVC light. UVC light is important because it has been shown to kill things such as anthrax, MRSA, influenza, other viruses, typically within 1 minute of exposure. What we're going to be doing is we're going to be using this in each treatment room after a patient has exited. The room must be empty, and we will sterilize these rooms for 10 minutes at a time after use by a patient. That way we can be assured that not only are the surfaces clean, even though we're cleaning them with hospital grade cleansing supplies and solutions, but also the UV light is going to kill anything that's on the surfaces themselves. In addition, the UV light will kill anything in the air that is left behind by either somebody breathing or by any aerosols or anything that's created during the actual procedure. Our staff is also obviously very important, and we're taking many changes and many steps to protect them. One of the first steps that we're doing is we're getting new uniforms, one of which I am wearing here, where you're going to see that staff members will be covered from their hands all the way up to the necks and completely down. The uniforms will be made of fabric that has silver fiber woven into it, which has been shown to inhibit the growth of any bacteria, viruses, fungi. So it's a great, safe alternative to traditional scrubs. In addition, we've been able to find US-made face shields that are heavy duty and will protect both the doctors and the assistants and other providers from any type of aerosol or splashes or anything that may be dangerous to the provider while providing care of patients. N95 respirators are provided for each staff member that will be treating patients. Plexiglass shields are installed at desks, including the front desk and our reception desk. We appreciate you being part of our family here at Madison Avenue Face and Body and NYC Laser Dentist, and we hope this is a good insight into how we're keeping you safe now and in the future. Thank you.